Hey there, welcome back. We're still in diabetes medications here as part of the diabetes eating and wellness class. Thank you so much, Dana, for helping us understand each drug class as they come. So we are here on the TZDs. Let's hear all about them.
How about you say that long word, Caroline?
I knew you were going to ask me to do that, and I'm not going to embarrass myself with that. That's why I said the
Me
TZD.
either. Let's move on. We're in the TZD class, folks. There is really only one medication on the U.S. market currently for the TZD class of meds, and that's Actos, otherwise known as pioglitazone. We used to have another medication called Avandia that was on the U.S. market several years ago, but that's no longer prescribed, it's no longer available. So Actos or pioglitazone are going to be the main medication that you see. This medicine, again, is inexpensive. And so that's one of the main reasons that we use it so commonly in managing blood glucose levels, is that this actually rounds out the three medications that we have that are generic for glucose control. One being metformin, two being the sulfonylurea class, glipizide, glyburide, glimepiride, and then this third class, the TZDs and Actos, being the third and final generic drug class for glucose control. TZDs help your body to better utilize insulin. So one of the main problems in type 2 diabetes is insulin resistance, meaning that your body cannot effectively use its insulin to control your blood sugars. It helps a little bit, but it doesn't do as well as it should. That's where we use the TZD drug class. It's helping the muscle and fat cells in your body to better utilize the insulin like we need it to keep your blood sugar levels more stable. One of the additional benefits of this medication is that it also helps to decrease the glucose output from your liver. So going back to what we discussed with metformin, like the TZD, is also going to help to reduce the amount of glucose being released from your liver so that you don't have all this extra glucose floating around in your bloodstream that your body simply doesn't need and cannot utilize. And so if we keep all of that sugar in the blood, it's going to drive up the glucose numbers, and it's going to eventually drive up your hemoglobin A1C. So using the TZD class of medications is going to help to reduce that glucose level, and it's also going to help your body to better utilize the insulin that your pancreas is trying to crank out to keep your blood sugar levels stable. One of the main things to discuss is that TZDs are not immediate. And so it can take several weeks, from 6 to 12 weeks, to see the benefit in glucose reduction from this class of medication. But there is a benefit in that it's helping us not only with your glucose levels, but also with the insulin resistance. So just hang in there for a little bit longer before you fully see its effects. One of the common side effects with this medication can be low blood sugar, mainly because if we have less glucose in our bloodstream and we are able to better use the insulin that our body is making, it can kind of create a perfect storm that your blood sugars go from very high to all of a sudden we're more insulin sensitive, and then we can drop them pretty quickly. Not quite as common because these medications take a little bit longer to work. But if you notice 2 or 3 months into your prescription that your sugars are coming down a little bit too low, give your healthcare provider a call so that we can discuss your dosage. The primary side effect that I warn my patients about and that I want you to be mindful of is fluid retention. And so if you start to see a collection of fluid in your lower legs, specifically around your ankles and in your feet, I want you to call your healthcare provider, because one of the primary side effects of the pioglitazone or Actos drug class is that you can hold on to fluid. This can put a little bit too much workload on your heart, and it can lead to other issues that we can prevent by treating the problem now by either reducing your dosage or discontinuing this class of medication if needed.
Great.
Leg, arm, back, and muscle pain do not happen quite as frequently. Dizziness can result, especially if your body is holding on to too much fluid and it's not getting back throughout your body the way that it needs to. Nose and throat irritation, not quite as common. Weight gain is a primary side effect of this medication, going back to the fluid retention problem. And so if you're gaining weight, but your diet has not changed, and especially if you're seeing more fluid around your ankles, that warrants a phone call to your healthcare provider. In this severe list of side effects, bladder cancer is one of the main reasons that Avandia was taken off the market. And so Avandia is more tied to the bladder cancer risk than Actos. And so that's not as much of an issue now that Actos is the only one available on the market. But in your second bullet, congestive heart failure is one of the main problems that we're trying to offset by monitoring your weight and monitoring for the fluid around your ankles. If you have congestive heart failure, do not take this medication. If you have a new healthcare provider or a new endocrinologist that may not be aware of a previous diagnosis of congestive heart failure and is prescribing Actos or pioglitazone for you, then you need to let your healthcare provider know that you have CHF or congestive heart failure and that this is not going to be one of the best drugs for you to take. Lactic acidosis and kidney failure, if these are pre-existing, again, like we've talked about in some of our other modules, it can just cause to the it can lead to the ingredients in this medication building up in your bloodstream and can make you sick. And so can, again, discuss with your healthcare provider if this is the best medication for you. Bone fractures, in particular, if you have a history of osteoporosis or osteopenia, then we may need to discuss whether or not you should take Actos or pioglitazone, because this drug class can lead to bone fractures. And if you're already predisposed or you're already at an increased risk for these fractures, then Actos is probably not going to be one of the safer medications for you. In particular, if you already have a diagnosis of macular edema, any vision loss, or pre-existing liver damage, then have a discussion with your healthcare provider about either starting this medication, because you may not need to, or if you have a new diagnosis of any of these problems and you are already on Actos or pioglitazone, then meet with your healthcare provider to discuss if you should continue or change your dosage.
Great. Thank you so much, Dana.